Good morning and thank you for joining us for All Things Heart. I'm Alexis Del Cid. We had hoped to bring you an episode featuring Chiefs Hall of Honor player Art Still and all his work to raise awareness of a rare disease that affects the heart. Unfortunately, we need to reschedule that episode, so today we bring you an encore presentation with the journey of a patient who is sure to make you smile. Born with a heart defect, Allie Baker had the same doctors and nurses for decades. But as she aged out of pediatric care, she faced a huge challenge, an all-new care team. And at first, it was daunting. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Like so many people born with serious medical problems, Allie Baker's care team felt like family. She had quite literally grown up with a team of doctors and nurses that had been treating her since she was born, which is why transitioning into adult care could have been very stressful. It would turn out it was something she and her family didn't need to worry about at all.
You got pecan, sprinkles, white chocolate and dark chocolate.
If last names are any predictor of what you'll do later in life, Allie Baker is the perfect example.
Oh, I love it here.
She began working at White's Food Liner in Osage City as a teenager, gradually moving from cashier to her dream job of baking and decorating sweets.
I love being up and moving around. It's honestly my favorite thing to do. I can't sit still. I never can.
Active and very social with an amazing giggle. When she's here, Allie's in her happy place.
We decorate cakes and stuff. I do cupcakes.
And yes, she also has a sweet tooth.
I love eating them. They're like my favorite thing to eat. We got a lot. I also love frosting in general.
Her love of this environment is something she picked up from her grandma.
I loved going around with my grandma to churches and being in the food pantry, learning how to cook with her.
But there are some things Allie always knew she couldn't do.
I loved to play soccer, but I couldn't do all the running.
Born premature with a congenital heart defect, Allie ultimately needed open heart surgery when she turned 21.
Part of my aorta and my valve was replaced 2 years ago in Children's Mercy.
About a year after that, Allie faced another big event. She was aging out of pediatric care. It was time to transfer to the Adult Congenital Heart Disease Clinic at the University of Kansas Health System. A change that could have been very stressful, Allie says, were it not for the clinic director, Dr. J.D. Surface.
His positivity, his knowing how to talk to people when they're nervous, which is me all the time.
Also a huge help in the transition, doctors and nurses at Children's Mercy, who also make sure everything goes smoothly and that the care is seamless.
I love the team. I love how they helped me get to other doctors.
And Allie has this advice to anyone preparing to make that same transition.
Don't be nervous. You got a great team behind you. They're willing to help you no matter what. No stupid question. Ask them no matter what. I do it all the time.
We are so happy to have Allie Baker joining us in studio. Your giggle makes me giggle. It's infectious. Does anyone ever talk to you about doing voiceover work or bottling it up for? You could make some money on that. So we have Allie here today alongside her grandma, Tony. Tony, you drove here all the way from Texas just to be part of the program and be near your granddaughter. Thank you so much for making the drive.
My pleasure.
And we are also joined by cardiologist Dr. J.D. Surface, who is the director of the Congenital Heart Disease Clinic, Adult Congenital Heart Disease Clinic here at the health system, and cardiologist Dr. Toby Rockefeller. Dr. Rockefeller works here at the health system in the clinic, but he also specializes in pediatric cardiology at Children's Mercy Hospital, so you're representing Children's Mercy as well.
Yes.
We got the crossover
Absolutely.
episode right now.
Yeah.
Thank you for joining us.
Thank you.
Allie, you've been a cardiology patient since you were born. How are you doing today?
Oh, I'm doing all great. I mean, working full time, just having the best life and going on an adventure all the time.
Including a new adventure you have up and coming. Show us your hand.
Yes.
Allie got engaged. Congratulations. Congratulations.
Thank you.
What's the lucky guy's name?
Noah.
Noah. Okay, is Noah watching?
Probably.
Okay.
That or he's asleep. He just had his
Noah
wisdom
got a
teeth
keeper.
removed.
He what?
He just had his wisdom teeth removed.
Jeez.
So
He's hopeless. He's helpless now, right now. Okay. I like that. So as you got older, Allie, how did you feel knowing that one day you would have to transition out of pediatric care into adult care?
I was nervous, but I wasn't as nervous. I mean, I have a great team to help me walk through the steps and everything.
Right, and that's we're going to get to Dr. Rockefeller's role in that from Children's Mercy. Now, Grandma, you helped raise Allie. You are her rock. She says you are just her rock and her rock star. When you were raising her as a child, did that loom in your mind that one day she'd have to find an all-new care team?
Yes and no. I really didn't think about it that much. You know, I tried to just raise her as normal as I could. And she calls me her rock, but she's closer to Grandpa.
Oh, you think so?
Grandpa's right here.
Well, she talks about you a lot and how you put the legacy of baking, the baking itch in her. She loves baking now and doing sweets. Does she ever cook for you?
Yeah.
Sweets and stuff? How does it measure up? Feel like you taught her well?
It's almost as good as mine.
That's a good answer. Dr. Rockefeller, you see pediatric patients at Children's Mercy. You also see, as we've been talking about, patients here. You have a sub-certification in adult congenital heart disease. The process with Children's Mercy and the University of Kansas Health System is, in a large part, to you and Dr. Surface, pretty seamless. It's a blended system. What does it mean to have a blended system?
Well, I do think the programs have been blended for years. You know, sharing patients, sharing expertise. In the past, we've always been going, you know, Children's Mercy physicians going to Kansas, helping with cases that are really complicated, and vice versa. Physicians from KU coming over to Children's Mercy helping with complex cases. But for me personally, it got really blended in 2021 when I started physically seeing patients here in the clinic. And so I have a pediatric clinic, I have this adult congenital clinic, and then I do cath cases at Children's Mercy, and then I work with Dr. Surface doing cath cases over here. So for me personally and professionally, it became really blended in 2021. And in the future, we're trying to make it very formal, this blending with an accredited congenital program.
Well, it's pretty fascinating, the teamwork that we see. And we see so much teamwork between Children's Mercy and, as you were saying, the University of Kansas Health System on so many cases. At what age does the transition start to begin on your end from pediatric care into the adult clinic with Dr. Surface?
Yeah, we try to really talk about it when kids are in the 14 to 16-year-old range.
Ahead of adult then.
So we're trying to start their minds thinking about the future. You start thinking about, like, where am I going to go to school? Where am I going to live? What job am I going to do? You start thinking about those things in high school. You should also start thinking about, where is my medical care going to be? Because these patients need medical care, you know, their whole life.
That's a big lift to ask of a 14-year-old or a 15-year-old. I mean, my son's 18, and I have a lot of questions about logistics. I can't imagine talking to him, and most parents can't talk to their teenager about finding their own set of doctors and such. Yeah. Do you see the parents' eyes glaze over and the look of fear in the kids' eyes, or are they just kind of...
Almost always, they're like, we're talking about this now?
Yeah.
And it's nice to just at least plant the seed. Like, you're going to need to have an adult team at some point. And obviously you're not transitioning them out of the clinic at 14 years old, but you start telling the patient, you need to know your medicines, you need to know who your doctor's names are, you need to know what your heart disease is, you know, start taking some ownership of it. And then it's, you know, gradually they take more and more ownership as they get older. But starting the wheels turning, you know, around 14 to 16 years old is what we try to do.
So Dr. Surface, on your end, when you're getting these new patients, what is the process? You're so passionate about making sure it doesn't feel stressful for anyone. What does it look like on your end, learning all these histories and learning with your team of nurses and specialists there?
Yeah, I mean, that's one of the hard parts about adult congenital heart disease is patients like Allie are complicated and they have long histories. You know, they've had multiple prior surgeries and interventions, complex anatomy, some of which can be very unique. And it does take it takes a lot of time and a lot of care just to go through everything, just to try and meet the patient where they are from a medical standpoint. But at that moment of transfer of care is a really important moment as well, because you have to meet patients where they are from a emotional and mental standpoint as well. You know, Allie, you worked with the same team of doctors and nurses for your entire life.
Yeah.
And then all of a sudden here you are in a new center in a new building with new people. That can be really overwhelming.
And trying to navigate this building.
That's right.
Which I still get lost. I still get lost.
That's
right.
I got lost this morning.
Yes, you did. It's true. Don't feel bad if it happens to you. So, what does the first meeting look like? Is it who has more questions, the patient and their parent, or you and your staff?
I would say that depends on the patient and their parents.
I would say I had a lot.
Yeah. What were your biggest questions, Allie?
Honestly, I don't remember. I was just throwing them out there. I mean, I'm just a person to throw out questions.
Which is so good, as you talked about in the story we aired before this live program, is that don't be afraid to ask questions.
Yeah.
And you're a big advocate for yourself. Now, Tony, did you come with Allie on the first visit, or were you living in Texas when she transitioned over to the adult care here?
I was living in Texas and not able to be with her. When I got her initially, she was 20 months old.
Oh my gosh.
And I had no clue what to do.
Was it just like nail biter? Like you didn't know?
Well, I used to have dark hair.
Turned your hair white. Was it like a crash course in learning cardiology?
Yeah, I guess you could say that. But her grandfather and I, we just treated him as normal. You know, we try not to make a big issue out of her condition. We didn't stop her from doing things. We allowed her to experiment, play soccer. She played softball, t-ball, or whatever. At one point, she wanted to take, I think it was dance lesson. It was dance, and she was about 8 or 9 years old. So
it was hip hop too.
Oh, how are you? Are you good?
Well, did not go back.
She went to one class, and she came back, and she said they wanted to teach me what I already knew. So, she didn't want to learn; she wanted to dance.
Right? Did you wanted to perform?
Yeah.
Yeah,
Just be
I
my
can
own
see
person.
that.
Just be your own person.
I can see
that. Was that. Save my money. So.
Dr. Surface, the Adult Congenital Heart Disease Clinic began in 2001. You weren't here since the inception of it, because you would have been 12, or I'm not going to ask you your age. But how has it evolved now, looking back at what it was and what it is now?
Yeah, that's a great question. Like you said, I haven't been here for really less than 2 years now, but the Adult Congenital Heart Disease Clinic was started by a doctor by the name of Kevin Mulhern, who has since retired, but he did a tremendous job over the course of multiple decades here, building up the clinic and building up a program. And it was actually when he started to approach retirement that the health system realized, wow, he's been doing this important stuff kind of on his own for a long time, and we're going to need some help when he retires. And that's when they first recruited Dr. Rockefeller to come over and staff the clinic, and they've made subsequent hires. And in a lot of ways, that transition's been great, because it has the health system learned, wow, this isn't just a guy on his own doing something. This is a program. We need to invest in a program, and the program has grown in leaps and bounds over just the short time that I've been here. And so we now, I'm happy to say, really have all of the resources that anyone could need as a patient with congenital heart disease available here at the health system, and with a really robust collaboration with Children's Mercy. So it's really turned into a top-tier tertiary care adult congenital heart disease program in a what, when you zoom out, is actually a pretty short time.
Yeah, I'm amazed at the volume of patients, like the number of patients that we have, but also the patient complexity. I think that's the big evolution over the last 24 years, is looking at the patients that come out of the pediatric system, with really complex heart disease. And so the care of these patients has just gotten exponentially more complicated. Like with all the imaging, all the cath interventions, all the things that patients need, it has just gone up in the number of cases and the complexity of cases. So I think that's the biggest shift looking back on 24 years, even though I wasn't here
24 years ago, right? None of us were. You were probably what? You weren't born yet. How old are you, Allie?
I'm 22.
22, right? So this is before.
I don't remember.
Yeah, you're supposed to lose track after 40. Not
I
when you're in your
lost track after
20s. You still have things to
21.
celebrate. Oh, that's good. So it must be a comfort, Dr. Rockefeller, to these patients who see you at Children's Mercy and then to actually see you physically in the health system, because I was surprised. I wasn't expecting to see you, even though I came up there to interview one of your amazing nurses, Diane Kovich, who we have an episode on her coming up a little bit later in the season. And I said, oh, Dr. Rockefeller, you have an office here. So you legit see patients there and then say, okay, I'll see you in the next building.
Yep.
And
my
such a
favorite
comfort.
line to patients is, it's the same me, just a
Right.
different building.
Right.
And I think that hopefully alleviates some of the anxiety about
Oh my gosh.
the transition. And I've been here coming up on 4 years, and it's been really nice to see patients on the pediatric side who are already anticipating the move, but you can tell they're just not as anxious about it.
I wouldn't be as anxious if I knew the same person was going to be holding my hand and then physically being there and then introducing me to Dr. Surface. And
Yeah.
we hear so many patients say, when Dr. Mulhern retired, I didn't know what I'd do. And then I met Dr. Surface and Dr. Rockefeller, and it turns out it was fine.
Yeah.
It was a nothing burger they were worried about, which is how most worries go, right? You
gonna say.
worry, and you're fine. We have so many questions coming in and comments on this program. If you have a question or a comment, you can send it to us on YouTube, Facebook, the All Things Heart email. All the links on how you can connect with us right now in real time are there on your screen. Dr. Rockefeller, I want to ask you some questions about Allie. She was born premature, missing one of her valves, and had a heart murmur. Now we know heart murmurs aren't a big medical deal, so to speak. You probably have a different way to talk about heart murmurs. But what are the challenges and the other issues Allie had as a baby in treating those challenges?
Yeah, I think for Allie in particular, she had pulmonary atresia. Missing a valve is a big deal. You don't have the valve that allows blood to go to the lungs. But for babies in general, the biggest challenge, I think, is making the diagnosis.
Oh.
We try to make the diagnosis as early as possible before babies are struggling. And many times we pick up the disease before they're even born now. We pick them up during the pregnancy. So
Like
we kind of
during
know
a scan, you can
during
see
the scan,
something?
we can see, oh, this heart is missing a valve. So we can anticipate a lot of these problems, but that doesn't happen every time. So babies are born,
Yeah.
and they're struggling. And so while they're struggling, you got to make that diagnosis.
There are parents watching this program from all areas of the country and the state. So what happens, what symptoms do they look for if it's not always picked up on a scan ahead of time?
Yeah. So for Allie, the problems became readily apparent, shortly after birth, with oxygen levels not being normal. And with the oxygen levels not being normal, it kind of is obvious that something's wrong. But babies that are really struggling with their oxygen levels, that needs to be worked up. And it's nice to know that there was legislation that passed that requires babies to have a pulse oximeter put on before they leave the hospital to check, is your oxygen level normal or not? So we pick up a lot of critical congenital heart disease before babies leave the hospital so that they don't come back in a bad situation. But she was born premature as well, so
Right.
baby's size matters a lot. We've got to get blood to the lungs, we've got to get blood to the body, and those circulations have to be well balanced or things don't go well.
You need those lungs for that giggle.
Yeah.
Yes.
And you have such a big personality, you need something to contain it.
Oh,
A
yeah.
vessel to contain it. How far of a drive is it from where you grew up to Children's Mercy Hospital?
So maybe an hour and a half.
And how often were you making that drive?
Quite a bit. I mean, just depends on when we can get scheduled and what appointments I have coming up.
I should ask Grandma, how often were you making the drive? That's a lot.
When she was little, we lived in Leavenworth, Kansas.
Okay.
And we drove out here to Children's Mercy, so it's about an hour or so.
Okay.
Fortunately, I only had to come a couple times.
Yeah.
I think only twice to the ER. Once was shortly after I got her. She was majorly congested, and I had no clue. I never had a sick child.
Right.
Okay. I had no clue. I didn't know if she had a cold, or she was just congested, or if she was having an asthma attack, or I didn't know. So I brought her here.
Oh, how stressful.
And they admitted her. And in the 4 days that she was here at Children's Mercy, I learned maybe 2,000% of how to take care of her. Just
Wow.
watching the nurses and the interaction and stuff. And at the time we got her, Allie, this always struck me. When I would look at her, her eyes were like hollow. It's like she had this look in her face like, who am I, what am I, something. There's nothing there. And when she finally started feeling better and she got up out of her crib and she put her arms out to be picked up, that look went away. And when Grandpa came in, I mean, it was love at first sight with those two anyway.
So sweet.
And that look went away, and that was like the biggest blessing. It's like, okay, we'll survive this.
Oh my gosh.
Yeah.
And
Up
really,
until that time, I was like, what am I going to do with this baby?
sure, so stressful. And now to see Allie now, I cannot imagine. Hollow eyes is the last way anyone would ever describe you.
Right.
Yeah, it was like
You're like a little
there was
sparkler
nothing there.
going
Like
off, right.
She didn't know where she belonged, or who cares about me, and she instantly knew. You know,
Right.
when she threw all, because we never left.
That's so sweet.
The whole time that she was there, I never left. Grandpa was there.
Yeah.
Mom came in a couple times, but that was to me, like this is my daughter.
Yes. Oh, that's so special. That's beautiful. Dr. Surface, pediatric cardiology patients are graduating to adult care more every year, which is incredible. What do you attribute that to?
Well, really, the whole field of adult congenital heart disease is a testament to the success of pediatric cardiologists and pediatric cardiac surgeons. If you go back, 50, 60, 70 years, a lot of these defects that patients would have been born with would not have been survivable. But over the decades, as surgical techniques and catheter-based techniques and medical therapy have all improved, 95+% of children born with even complicated heart disease will survive to adulthood, and not just survive, but thrive. And live good, long, full, awesome lives. And that's why we're here, and that number just keeps on growing. The population is growing. And it's in part because of the recognition of that Children's Mercy put together their formal transition program. And I want to give a lot of credit to that, because they, just as Dr. Rockefeller said, they'll start talking with patients at around 14 or 15 years of age, but it's a long process, and it's a very structured process that culminates in a visit between Children's Mercy and KU members to go over everything together. And so when patients come into our system from Children's Mercy, we have this very comprehensive assessment of exactly where they are from a medical perspective. And it's so much easier and smoother on both us and on the patient to have gone through that process. So it's been a very successful program.
What a gift to families. And Children's Mercy is working with the tiniest of hearts, these tiny little hearts.
I
And
could not imagine. They did reconstructive open heart surgery on her when she was about 4.5 months old.
oh my gosh,
And I cannot imagine them doing that.
the stress.
The procedure itself.
Yes, yes,
And at the time, I wasn't there again, but her aunts were.
right.
And and then they kept her in a coma because her chest was open for like 2 weeks to make sure there was no bleeding, that everything was healing, and so they didn't want her moving around, so
Sure.
she slept. I think she spent the first year of her life pretty much in a coma.
I mean, Allie's not someone that can be kept quiet or still, so I would imagine that's the only way to keep you still.
I hate being still.
Right.
I have to move around.
And it's been that way since you were born, I'm sure. Dr. Rockefeller, you talked about, when we first started emailing, making sure that pediatric patients don't get lost in that change from pediatric to adult. How common is it in places that don't have this collaboration for patients to kind of fall off the radar if it wasn't for your program?
Yeah, I feel like a lot of patients were lost to follow-up in the past, and there's some papers out there that they've estimated lost to follow-up rates all over the board. There was one big study that looked at and found that about a quarter of patients were lost to follow-up.
A quarter?
They grew up, graduate high school, life happens.
Yeah.
They may move out or go to school, get a job, and if they're, the things they found that were more likely to cause patients to be lost to follow-up were less severe heart disease, so it's easy to forget about, or distance from an ACHD center. So if you live really far away and seeing a specialized program is more difficult to do, then you just don't do it.
It makes sense then why you would start talking to the families at 14 years old rather than right before high school graduation or right before college or what have you.
Yes.
Dr.
So I was going to say our goal has been to try to minimize that loss to follow-up rate, and one of the big things about our transition clinic is that it's virtual. So people don't have to drive anywhere. They just sit on their couch, get on the phone, and that's where I met Allie for the first time, was in a virtual appointment.
She jumped through the
I
screen.
think I was at work at that time, so I was because I'm always
Maybe not
at
on your
work.
couch.
No, but I was always doing something.
Yeah.
Did you get to hear her giggle right off the bat?
Yep. I think you were working.
Yeah, I was at work and I think I went and hid in the closet.
Yes.
With your little frosting.
I think I
with your
remember
favorite
asking, where are you?
hiding in the bakery closet. Dr. Surface, you combine all the visits and testing, or you try to do it all in one day. How hard is that to do, and why is that a priority for you?
Great. I mean, so first and foremost, we're not always able to coordinate that because sometimes patients need complex testing and sometimes it's not clear that they need it until we meet with them. That said, we try really hard to make that happen, especially for patients who are coming a long ways away. We're the only adult congenital heart disease center in Kansas, and so we have a lot of patients who come from a long, long way away. And to have to come to see us and then say, okay, now you need to come back and get your echo in a week, and then you need to come back and get an exercise test, that's too much.
Yeah.
Whereas if you can put it all in one day, it's just so much easier for patients. It does take a lot of coordination, and we have a whole team of nurses and coordinators and navigators who really help make that happen. And if we didn't have them, it would not be possible to put all this together.
Your team is incredible. I said, we were just up there working on another episode on the Adult Congenital Heart Disease Clinic, and your team is phenomenal.
I couldn't agree more.
Some of them are also former patients.
That's right.
Which we'll have to talk about that during a later program. I do have some questions coming in from our viewers, so I want to get to those. And remember, if you have questions, send them in right now. We'll read them on air. Stu wants to know, do adult congenital heart disease patients typically need other specialists outside of cardiology, like pulmonologists?
Yes. Oftentimes our adult congenital patients do need other subspecialty services. Pulmonology is one of the most common. We also have patients that need hepatology.
Do you
like a liver doctor.
coordinate all that? How do you do that?
So we are certainly kind of a portal for referrals to other systems, other subspecialists. And we often do have conversations behind the scenes with those other specialists trying to figure out, what is the cause of their symptoms? Is it related to their heart only, or is it something else potentially? But yes, it is actually pretty common that they need other services involved. And that's what we try to coordinate.
You're nodding your head yes as well.
Very common.
It's a big part of your...
There's a lot. The name of the game in really medical care in general, but maybe especially in adult congenital heart disease, is what we call multidisciplinary care. Patients need a lot of people and a lot of expertise all working together and communicating with one another to give them the best care.
When you do it like that, it takes the stress off the patient, and they continue to come back because it's not this stressful nightmare. I got to say, before I started working here and switched over to having doctors all on the same team, going from place to place to place was just a nightmare. It would take you weeks to do that. Jeremy wants to know, he writes, I hadn't ever really considered before this that it's more of a category than a specific condition, that heart structure can be unique depending on the person. Jeremy would like to know, what are some of the structural differences that can drastically alter how you would handle the treatment? Broad question. Anyone want to take that?
Wow.
So congenital heart disease is an unbelievable spectrum of severity and almost every possible arrangement of heart structures. All the veins draining the blue blood from the body, they can come back in all sorts of different abnormal locations.
Right.
And then we have 2 ventricles, one pumping blood to the lungs, one pumping blood to the body. They're specifically designed, really, to pump at certain pressures, and sometimes those ventricles are backwards, or sometimes patients are missing ventricles, or sometimes there's huge holes between the chambers. Sometimes the arteries are in the wrong spot. And so for us, the challenge is making an accurate diagnosis and then making a plan that makes sense for each individual patient that gives them a good circulation right then as a baby, but also sets them up for success in the future.
Into their adult care.
You can't do things that totally wreck your options in the future.
Right.
So you have to think, how do we get a good result now, but also how do we get a good result 20, 30, 40 years from now? And I think that's the biggest challenge in pediatric cardiology. It's one of the reasons I love it.
I love that you guys love what you do. I have one more question, Dr. Surface. Have you ever had any patients that come to you that have had a 5 or 6 year or this huge gap in care because they
commonly.
didn't
Very
know?
Commonly. Yeah. Yeah, no, it's, the 25% loss to follow-up that Dr. Rockefeller is probably, in my mind, an underestimate, especially historically. And it's not at all uncommon to see patients who have not been seen in a decade or more. And when that happens, bad stuff can happen.
Right.
Because stuff develops slowly. And so a lot of times patients don't notice that they're doing poorly. They don't notice that they're limited because it develops so slowly, and so they don't present to care until things are really bad. And a lot of times when things are really bad, our options become limited in terms of what we can offer, and they're much higher risk. So it's much, much, much better to stay in care.
Before something goes wrong,
And that
before
way
you feel.
Exactly.
Yeah.
And if we can identify that thing going wrong sort of right when it starts going wrong, then we can identify the optimal time and the safest time to do something about it.
Right.
And that's what a lot of our follow-up is all about.
This is a fascinating conversation. And again, Allie, I'm so thrilled you were able to make it. And Tony, I'm so impressed you made the drive, ready to go, came all the way up from Texas. I just love the love that you have for each other. For some final thoughts from our guests, I want to start with Allie. What's your advice to people watching, whether it's a parent or a kid watching this program?
Go for the call. Do what your heart says. Always trust your gut feeling. Never estimate how your body feels. Just go for it.
Go and ask.
Yeah.
Take charge.
Yep.
Tony, anything you'd like to say?
Well, I think that as a grandparent raising a child like that, you're aware that there's something wrong and you want the best for them. And so you find the best care, you take that extra step to find the perfect person to care for that child. Don't matter what the cost is. You just do it.
Yeah. As you do and have done. Dr. Rockefeller, anything you'd like to say or like our audience to know?
I'm sure there are people watching that have young kids with congenital heart disease, and I think the biggest thing is don't lose hope. Sometimes you feel like it's a really difficult situation. You don't know what the future looks like, but hang in there. All the things that we're doing, didn't exist at some point in the past. So technology is changing. Our ability to intervene is changing. Things are getting better as time goes on. So hang in there. Find a support system that is really there for you, working with you, including your medical team. But we're here. We're here for you.
Truly, they are. Dr. Surface.
Mostly I just want to thank Allie and Tony for being here. So thank you. It was a pleasure meeting you in clinic.
You're welcome.
And it's really fun to get to see you in this arena, and congratulations on your engagement.
Oh yeah, when's the wedding? Do you have a date set?
We take it day by day.
I bet you're in charge though. You have a vision. Thank you so much, and thank you doctors for making the time. Thank you so much for joining us. We'll see you right here next Thursday for an all-new episode of All Things Heart.
If I didn't stop everything I was doing, probably would have dropped dead at the gym.
The young man who faced his second life-threatening medical condition before the age of 30. The surgery and the surgeon who saved him while stopping his heart for 4 hours. Next Thursday at 8 a.m.